Alright guys, so we're going to correct Carrie's upslip in this video. So this is one of the most challenging moves, I would say. It is correcting that upslip that you saw in the beginning, so that elevating hip. So she's all set up because we've done all of our other corrections so far. But if someone just needs an upslip, which I don't think I've ever had, you would have them do that bridge to prepare and set down and give them a little tug. Then I'm gonna bend her leg for her. So now it's right where I want it to be. It's pretty much in line with the hip. The thing that happens here is because people have either a medial or lateral rotation of the foot and leg, a lot of the time the foot will turn out, and so I often will just stabilize that foot where I want it to be, or I'll turn it in and I'll tell them, like, keep your foot planted, because people want to mess with that. But then it's actually more about relaxing it after that, and it doesn't really matter where the foot goes. So that's just initially. Then what you're gonna do is you're gonna use both hands, and you get in and you actually kind of use your arm too, and you're twisting the thigh, so you're getting like a yoga inward rotation, inner spiral going. So you twist the thigh in and down, and then you traction it away from the body. Now again, she's relaxed, so that's what we want. We want her to stay relaxed. This is also a lot of work, so you have to get your timing good. And again, practice, you'll get better at it. But twist, traction, and then they take a relaxing breath in, relaxing exhale. Good. Then she's gonna take a big deep breath in, and this whole time I've got traction on her. Then she's gonna exhale as she draws the hip up towards the armpit, so she's hip hiking against me. So that's our resistance. She's keeping her hip on the table, just sliding it up towards her armpit. Now she's gonna take a deep breath in, and she's gonna cough as she lets it go. Good, and I have been traction on her the whole time. So then we can relax it. And we'll do it one more time for you guys to see, but it is a funky move, and people really do have to cough, because what that's about is the nervous system distraction. So that's how the hip releases. That's how it resets this upslip, is it interrupts that nerve loop and it lets it go. Oh, it's like a spring reaction. Also, interesting thing about this test is you can actually release the opposite side, and often we'll get the correct reaction. So if you make a mistake, don't worry, the body actually is doing the reset, but you want to do it on the right side if you can, on the correct side, I should say. But just knowing that that's an interesting fact for the body. So again, we twist, traction, slide down while she's relaxed, then she resists us, and again, people's inclination is going to be to elevate off the table, but you want them to just slide up. So I usually will demonstrate for first time people what that looks like. I compare it to Conan's string dance, which, if that's not a reference for you, sorry. But it is that it's just this hip, like as if it were on a string, it's just coming independently up. So you kind of can play with that in your own body, so you know what you're describing to them, but you want their hip to stay on the table. Slides up towards the armpit. Another thing that happens here is people's upper body wants to like do some funky stuff, so their head and neck might get all distorted. If it gets really distorted, you may want to correct them a little bit before they release it, but oftentimes that's not really a big deal. Other piece to keep in mind, people will give you a wimpy cough, or like a exhale, basically. The cough is important. Carrie and I have a record that'll be coming out with coughs now that we've joked about the different levels of coughs people give us, and sometimes we get a good bass and other times it's lousy. But you do want someone to give you a substantial cough, and if they cover their mouth, whatever, it doesn't, that part doesn't matter, but it is this neural distraction that's imperative. So making sure they truly give you one, and if they don't, you can just tease them a little bit just to get them to give you a solid cough. Okay, so we're gonna do one more to show you. So big deep breath in, and relaxing exhale, I begin my traction. I'm twisting in and down and pulling away from the body. Big deep inhale to the belly. As she exhales, she's sliding up towards the armpit. Good. Make sure people breathe out there too, because this is also hard for them. Big breath in, and then cough and release. Good, and I'm hanging on the whole time. And then we relax it. Good. So that was an excellent demo. Carrie's really good at this. and hopefully your people will get there too.